What up, Internet? It's been a minute. My bad. Okay, let's talk Medicaid fraud. So that seems to be front and center again after this renewed effort by Dr. Oz, Home Health, Hospice, and all these things. There's this like 6-month moratorium. Go check that out. But you're hearing now more people talk about like, oh yeah, like I've identified fraud definitively in this, DOGE utilization data, this Medicaid utilization data that came out in February of this past year. It's monthly data. It's 2018 to 2024. And I'm just here to tell you that it is impossible to do that. It's not my opinion. All it's good at is identifying outliers and anomalies because there's just not enough there. It matters how that data is structured and knowing what sits under it. It's all about details. So that data has been cleaned, okay? Here's how it's all laid out. There's like 5 data points, pretty much. So there are procedure codes or HCPCS assigned to like NPI numbers. So that could be the clinician or like the billing service. And then along with that, there are the number of claim line items, the total amount paid for said claim line items, and the total unique beneficiaries, so patients. So it's aggregated at a monthly level. And it's just the amount paid per NPI. And that's it. That's it. And somehow people are saying, oh my God, I've identified fraud. You have just touched the surface. These are not serious people. Okay. Guys, there are companies that they go in depth and they look at a state's, entire repository, what's called MMIS. It's so much more robust than what I just described. And there's so much more legwork that you would have to do to come to the conclusion that there is fraud. You're just touching the tip of the iceberg. And I'm not going to get into PERM and MLRs and how all that's gamed and the fact that I think the entire process in terms of testing, we'll call it improper payments, is regulatory capture, which I think that it is. But my point is, I do think that there's a bunch of fraud, waste, and abuse across Medicaid. But you just cannot say, by looking at DOGE utilization data, that it's fraud. That's it.